he does not need further introduction, but it is Dr. Chamara Ratnayaka. He's a consultant cardiologist attached to Asiri Central Hospital, Colombo. He will talk to us on a very important topic, that is dietary advice for a cardiac patient. Over to you, Chamara.
Very good morning, ladies and gentlemen. Before I start this talk, I would like to thank the Sri Lanka College of Cardiology for inviting me to conduct this lecture on behalf of the college for the benefit of the allied health professionals. The topic that I was asked to speak about today is on dietary advice for a cardiac patient. And I think it's a very, very important subject. It's an important topic to speak of and to get knowledge on, as day in and day out we meet so many patients who have had heart problems, heart attacks, who have undergone certain cardiac procedures such as stenting and bypass surgery, for example. And it's important as health professionals to know how to best advise these patients as far as their diet is concerned. And on the other hand as well, it's a very common question that patients do ask from us following a cardiac event, following a cardiac procedure, as to how best that they should modify their diet as well. So it's very, very important to have a certain amount of background knowledge on how best to advise these patients. So before I start on the main topic as to how best to advise, I thought it's important to just get an idea as to how important it is to advise on diet control. Does it actually matter? So does a bad diet actually contribute to heart disease? It's a question that I always ask myself. Before advising patients, we should be sure that whatever advice that we're giving is actually scientific. Is there evidence to support that a bad diet contributes to heart disease? And there have been many trials over the last few years, and this was quite an important trial, quite a landmark trial published a couple of years ago in the European Society of Cardiology journal as well, where they took global statistics actually from a long period of time, or about 27 years, from the year 1990 to the year 2017, to see what the different risk factors and what leads to heart trouble, heart attacks, ischemic heart disease, for example. And you can see right on top here, dietary risk contributing to almost 70% of ischemic heart disease burden. So that's quite a significant impact that bad diet can lead to heart problems, heart attacks, ischemic heart disease. It's actually right on top, even more than high blood pressure, more than high cholesterol, more than high sugar, and even smoking. So you can see that an unsatisfactory bad diet definitely is a huge burden causing and leading to heart problems. So very, very important to keep in mind. And that's something that we can even advise our patients, that one of the leading causes of heart attacks in the world from research shows that a bad diet definitely is a contributing factor. And on the other side, I wanted to also emphasize, now we know that a bad diet can contribute to ischemic heart disease, it can contribute to getting heart attacks, etc. But on the other hand, does a healthier diet prevent heart attacks? That's also important, isn't it? So when we are advising patients on good diets, we should also have some sort of scientific evidence that adopting a good diet, a healthy diet, will prevent heart problems from happening in the first place. Again, there have been multiple trials, and this is what we call a meta-analysis, where they pool different trials to see if there is any benefit from adopting a healthier diet towards ischemic heart disease. Again, from the different types of diets in the world, we can see that patients who adopt pesco-vegetarian. So in other words, that is patients who eat fish and vegetables. And you can see that on the chart itself, they have a lower mortality. So that means that their health is better compared to people, for example, non-vegetarians who have a higher mortality level compared to people who eat fish and vegetables. Even those who have lacto-ovo-vegetarian, so for example, those who eat eggs, have a better mortality, lower mortality rather, compared to non-vegetarians. Vegans who eat only vegetable-based products also have lower mortality compared to the so-called non-vegetarians who eat different meat items, including red meats, etc. So we can see that definitely adopting a healthier diet will prevent ischemic heart disease and definitely prevent death from ischemic heart disease as well. So that's two important factors, I think. So again, bad diet leads to heart attacks, and a good healthy diet will prevent heart attacks. So we have scientific evidence to go by. So this is not just us randomly telling patients, eat this, eat that, this is good for you, this is bad for you. There is definitely some scientific evidence to support whatever we advise patients on as far as that diet is concerned. So that's very, very important. So what is the aim of giving this dietary advice to patients who have had heart problems? I think it's important to understand and to tell the patients as to why we tell them that it's an important thing to have a good diet. So obviously secondary prevention, we know that bad diets can lead to heart attacks. So if they've already had a heart attack, secondary prevention of that same ischemic heart disease can be avoided by adopting a good diet. Weight reduction, majority of our patients who have had heart problems, heart attacks, are overweight or obese. So having a healthier diet will definitely contribute towards weight reduction as well. And the other thing, very, very important, is risk factor modification. Majority of the patients who have suffered from heart problems or cardiac diseases would have had some sort of modifiable risk factors such as high blood pressure, diabetes, or high cholesterol levels. So by adopting better diets, by adopting healthier diets, it will definitely contribute towards modifying these risk factors, as well as we call lifestyle changes, including diet, will prevent or will modify or help modify these so-called risk factors. So very, very important as far as diet is concerned. And lastly, I think this is important, and this is something that we hardly talk about, right? But I think it's something that we need to think as well. So when a family member gets a heart problem, a heart attack, it kind of affects the whole family unit, isn't it? So there is a collateral impact. So by advising patients on preventing heart diseases, I think we kind of help the whole family also to adopt a better diet, because usually these families have a similar kind of a diet, and if their diet has not been good, it can lead to heart problems in the rest of the family as well, the wife, the children, the mothers, fathers, etc. In Sri Lanka, usually we have a huge family unit. So by advising one patient on healthy diet, it kind of leads to other family members also to adopt a healthier diet. And I think that's very, very valuable, especially from a Sri Lankan context, because I know we have large family units in Sri Lanka who live together. So to get to the bottom of it, so what does the usual balanced diet consist of? So we have this so-called plate concept. So the general advice is to have 40% of fruits and vegetables, about 25% in carbohydrates, about 25% in proteins, and 10% in fat. So that is the ideal kind of balanced diet that is recommended. Unfortunately, in Sri Lanka, we don't necessarily follow this concept. We have problems with the Sri Lankan diet. One big problem is the rice dilemma. We love our rice, isn't it? So Sri Lankans love to eat rice. Usually it's 15 parts rice, 2 parts vegetables, and 1 part meat or fish. So this is a definite big problem that we deal with. And this leads to a carbohydrate surplus. And research reveals that Sri Lankan adults get 71% of their energy from carbohydrates as opposed to what is recommended. So the recommendation is 25%. We have 71% from carbohydrates, only 10% from proteins, and 18% from fats as well. So our percentages are all very, very skewed. We don't have a lot of diversity in our diet as well. We have high carbs, low consumption of fruits and veggies. So that's very, very important. We have a love for coconuts, again, not ideal from a dietary concept and from a dietary perspective. So we need to advise our patients on this coconut craze as well. We have heavy dinners, which is not recommended. Generally, the evidence is that we should have light meals for dinner and to avoid late meals as well. So again, something that Sri Lankans don't necessarily do. We have a problem with oil. We use a lot of oil in our cooking, including coconut oil. And festive food. We love our festive food, isn't it? So during the April Alut Aurudu season, we generally have lots of festive foods, and including and then in the Christmas time as well, we have lots of festive food. So all year long, there is some sort of a festival, unfortunately or fortunately. So we tend to have all these heavy meals during this festive food time. So this is the problem with the Sri Lankan diet. So then, to cut to the chase, what is the general advice that we can give our patients as far as dietary advice is concerned following a cardiac event? So to divide them into different categories, so let's talk about carbohydrates. So we know that we have a problem with carbohydrates in Sri Lankan diets, but the important thing is to ask the patients to reduce or markedly decrease the simple carbohydrates. So that's foods that contain white wheat flour, such as bread, white rice, pasta, and sugar, for example. So these foods have simple carbohydrates easily broken down, and it can cause weight gain and increased sugar, etc., and not ideal for patients who have had heart problems. We advise them to eat foods that have complex carbohydrates. So the 25% carbohydrate percentage in a diet, we advise to have complex carbohydrates such as beans, whole grains. So, for example, kurakkang or atapiti, and avoid foods that have wheat flour like bread and roti and all those things. Oats are good especially for breakfast. That's something that I advocate to my patients as well, to have oats, again a good complex carbohydrate, sweet potatoes, and nuts. So all of these are good substitutes for the simple carbohydrates, and that's something that we need to advise our patients on. As far as proteins are concerned, again, important to advise our patients on protein content, 25% of the meal. So again, avoid foods that have animal fat. So for example, red meats, beef, lamb, pork, mutton, etc. should be avoided, definitely. Seafood, fish. We have lots and lots of fish in this country, so we should advise our patients to have more fish and less red meats. So most of the fish are good, but for example, the oily fish such as salmon, mackerel, tuna, sardines are very, very good as far as our diet is concerned. White meat such as chicken or turkey is preferred without the skin, and as I said earlier, avoid red meats. And another question that is often asked from us is egg consumption. So eggs, generally, again, 1 egg per day is not associated with bad cardiovascular outcomes. So we can ask a patient if they eat eggs, 1 egg a day is okay, nothing more than that though. Again, oil-wise, we should advise our patients to use olive oil rather than other oils for cooking purposes. Second best option-wise, canola oil is good as a polyunsaturated oil. Try to avoid vegetable oil and palm oil, which are hydrogenated, definitely has trans fatty acids, very bad prognosis. And also tell our patients to avoid reusing oils. That's very important. I think as a Sri Lankan custom, sometimes we reuse oils, and that's not advised because it can lead to trans fatty acids and heart problems. Avoid cooking with coconut oil. That's important. It's an important question that is asked always. Coconut oil, it's always a dilemma. But we can use coconut oil for deep frying. However, again, deep frying foods is kind of not recommended. But if you are deep frying any foods, coconut oil is the choice that we can use. And also have liberal quantities of fruits and vegetables. That's very, very important. So experts recommend 6 to 9 servings of fruits or vegetables a day. So I think that's, again, something that Sri Lankans don't do, especially vegetables. We have so many nice vegetables and fruits in this country. So we should advise our patients to increase the fruits and vegetables, avoid the starch, to reduce the rice and have more vegetables and fruits in their diet. And sugar, obviously, we know that we should avoid and try to reduce the sugar in the diet as well. So those are the kind of general advice that we advocate to patients following a cardiac event, heart attacks. And I think we can customize the diet according to these general advice as well. So before I end, this is a fantastic article that I read, which is done by a Sri Lankan group. Professor Ranil Jayawardena from the University of Colombo, who has published this plate model as part of dietary intervention for patients with following a myocardial infarction. So the important thing here is that as Sri Lankans, we kind of sometimes it's very difficult to advise our patients because we have to be culturally sensitive about certain diets, and we can't advocate the same diets that is, for example, advocated in other countries such as the USA or the UK, for example. So they developed this plate concept where they divided the plate into 5 slices almost, and told the patients to have the different quantities according to this rice, so this plate concept. And they found that patients who took this advice and had the plate concept had good weight reduction following a myocardial infarction. So they divided the plate, as you can see, into rice part, meat part, green vegetable part, yellow or red vegetable part, and mallum and green salad part. So those are the 5 parts. And they kind of had very good results as far as weight reduction was concerned. So this is my last slide. Just general considerations when advising patients on diet. I think it's important to have an idea. So before advising, ask about the previous dietary habits. So some patients, of course, after a heart attack, have had a reasonably good diet, and some have not. So just ask them about what their previous diet has been. And also important, does this patient need weight reduction? Some patients who have had heart problems are anyway lean. They don't need further weight reduction. So our diet advice should correspond to what the patient needs. Do they need weight reduction or not? It has to be very practical advice that we give. We should not be very strong, and we should not give them unachievable targets as far as dietary advice is concerned as well. Remember to be culturally sensitive. We need to be very careful in the advice. We cannot always advocate things that are given in foreign literature, for example. Emphasize the importance of maintaining the diet, because sometimes after a heart attack, the patients will have this attitude that they need to lose weight and they need to have a good diet. But after some time, after a few months, they kind of wean off. So we need to always encourage our patients, a few months later even, to continue to maintain the good dietary habits. Allow them to have an occasional cheat meal. We should not be always very strong in telling them you should never have all these things, because that's for their mental well-being as well. At a festival or at a function, for example, a wedding, it's okay to have something that you like, but overall, in a general way, to have good dietary habits. And always have a personalized plan. One patient will be different from another. Don't give the same advice to each and every patient. Always have a personalized plan so that every patient will have a separate advice as far as that diet is concerned. So if we kind of go in this method, I think patients will have better outcomes, and the risk of getting heart attacks will be less. And also recurrence of heart attacks in the patient who has had a heart problem will also be reduced. Thank you very much for your attention. That's the last slide that I have, and I'm more than happy to answer any questions that you may have as far as dietary habits in a cardiac patient is concerned.
Thank you, Chamara. Of course, this issue of diet is very close to our hearts, Chamar. I think sometimes I wonder whether we Sri Lankans live for food. Anyway, thank you so much and congratulations. You did a very excellent and extensive lecture and touched almost all the points about dietary advice to a cardiac patient. Let's move to the next